Conversations podcast.
Hello and welcome to Conversations podcast. My name is Ineke Crezee and I'm one of the Conversations podcast hosts. My role will be to host podcasts on anything New Zealand related and more. I'm a professor of translation and interpreting at Auckland University of Technology in New Zealand, and I have been teaching interpreting and translation in New Zealand since 1991. I'm a Ngāti certified translator between English and Dutch and vice versa, and I'm also a Ngāti recognised practicing interpreter. I welcome you to the very first podcast where I will be talking with my good friend and colleague, Dr. Uldis Ozolins, about the challenges of interpreting in speech therapy settings. I welcome you to this podcast.
Good. Thank you for listening to this podcast on interpreting and speech therapy. We have two speakers, Uldis Ozolins and Ineke Crezee. I'm Uldis Ozolins, and just briefly about myself, I've been a long-time academic teacher and practitioner in interpreting, and I've been helping all graduates on professional development and mentoring, and I have an interest and have published on interpreting and speech therapy. Ineke?
Oh, and welcome. And thank you, Uldis, for joining me today, because I view you as a much cherished colleague and an expert on interpreting in speech therapy settings, which has also been one of my interests in the past, and we will touch on that today.
Thanks. What we're going to do, I'll give a brief overview of the areas in which interpreters work with speech therapists. Then Ineke will give an account of nearly a decade's work of teaching interpreting students and speech therapy students to work together. Very interesting sessions. Then I'll be back to talk about some ethical and practice issues, and we'll have a brief summing up. Now, the area in which interpreters work with speech therapy are quite diverse. But there's probably two main areas. The first one is with children and speech development issues with children. Now, these are speech development issues that may have been picked up by teachers, by doctors, by parents. Sometimes it creates considerable anxiety with parents if kids are delayed in their speech or are not speaking in a way that seems sort of natural. Quite often this also involves not just working with the child, but also with the parents. So there can be quite complex situations that interpreters are involved with. Now, what are called speech pathologies are very various and have different causes. Some are genetic, but many are from aspects of trauma. And there's also just a factor that some kids will speak in a more delayed way compared to others. And there's a whole range of when people start talking and speaking in a way that's understandable. Now, one thing that should be said is that bilingualism itself or multilingualism is certainly not a speech pathology. As we know, children will speak as many languages as there are significant others who will speak those languages. So, and it should be said that bilingual or multilingual children have no more and no less speech pathologies than do monolingual children. So that's one area where interpreters and speech therapists work together. And another area is things that can happen at any stage of life, things like stuttering or swallowing issues. These can afflict people at any stage, often after some trauma of some kind. But the other big area of practice is with trauma that's a result of quite serious trauma where strokes orient speaking patterns. People lose parts of their language. There has been a lot of research into this, what's called aphasia. And aphasia means that there are certain elements of speech that you can't produce. There are various kinds of aphasia. In some, you find it difficult to find words. In others, you actually have got a lot of words, but they don't make a lot of sense. In others, you have bits of clarity and then bits of unclarity and so on. Now, there's been a lot of research into this. There's also therapy here that is conducted. People with aphasia can recover a lot of speech facility, perhaps not all of it, but a lot of it. And so therapy is involved, not only diagnostics. So they're the sort of areas that we find interpreters working with speech pathologists. And some interpreters find this a very different issue because you're concentrating on the minutiae of language. You're not just interpreting the messages, but you're paying attention to things like phonological issues, how people speak, and so on. And obviously, this is raised questions about, well, what should interpreters do? Ineke will now talk to you about her experiences of this sort of decade-long experience of getting interpreting and speech therapy students together to practice together on scenarios, and what they find and how those sessions are conducted, and what we find from the interpreter's performance. Thank you, Ineke.
Sure, that was a very good introduction. And you're quite right. In terms of child language delay, it's very often monolingual teachers or preschool teachers that are concerned about the bilingual or multilingual child's ability to express itself in English. And that's often where the referral to the speech therapist originates. And I have to actually go back to 2010, which is when I had a student who was very interested. She was bringing up her kids in a bilingual manner, and she'd become very interested in the fact that preschool teachers often diagnose children with language delay issues. And she actually wanted to do her research, and she had a hypothesis, which was that kids very quickly improve or recover skills in both languages once they start primary school. And so she got hold of some testing material used by New Zealand speech therapists, speech pathologists. And what struck both of us was that it was so very monolingual English in nature, that all the testing, of course, was done with sounds that occur in English. All the pictures were in English. And so our first thing was, wow, we need interpreters to work with speech therapists if the child is bilingual, and maybe the parent that's with the child only speaks, say, Mandarin or Cantonese or another language, not English. And so what happens if an interpreter works with a speech therapist? So I then got in touch with my friend Linda Hand, who was a lecturer at the University of Auckland at the time. And we started teaching each other's students. I was teaching her students how to work with interpreters. She was teaching my students what speech therapists do. And at one point, I had a light bulb moment. And I said to Linda, how about we actually get students to discover each other's role and what it's like to work with each other. So in 2012, we had the very first session, which involved her speech therapy students, who were actually postgraduate students. So they'd already done a 3-year undergraduate degree, and my health interpreting students to work together. And we learned a lot over the years. And one of the very first things that we learned is that when speech therapists test children for child language delay, they use all sorts of realia. Now, that's a word that lecturers and teachers use, and it means that the speech therapist will check to what extent a child can follow a two-element instruction, wash Dolly or wash Dolly's face or put Dolly on the chair, so it gets more complicated. So, and to make that work, they need to take dolls, they need to take teddy bears, they need to take monkeys, they need to have a little chair, they need to have a little washcloth. And so where in the groups where the speech therapy students had thought to take those realia, it worked a lot better than where they had to pretend, because then there's too much pretense going on, and it's quite difficult for people to imagine being in the real setting. What we got the speech therapy students to do was to write some scenarios based on their own experience, and that was very powerful because the scenarios were very realistic, and the lecturer, Linda, then checked them. By the way, she'd worked for years and years and years in Australia, and you can actually find quite a lot of her publications too. She's retired now, but that was very, very useful. The course that her students were doing was about child language delay. But I said to her, Linda, I know that we have to do child language delay scenarios, but please, can we also do some scenarios where the person is an older adult, maybe accompanied by a family member, and they've had a stroke? In medical terms, we call that a cerebrovascular accident, so literally an accident affecting the blood vessels in the brain, CVA for short. And as Uldis already mentioned, there can be all sorts of different types of issues after a stroke. And aphasia, from the Greek no speech, literally, is one of them. And as Uldis said, there's lots of different forms of aphasia. So obviously for the speech therapist to be able to develop a treatment plan for a patient, they need to first know what the problems is that the patient is experiencing. Do they have word finding issues? Do they create sentences which are very fluent but completely nonsensical? I think that's called Wernicke's aphasia. Or are they like my mum, who had a stroke, unfortunately, and she could neither swallow nor make speech sounds anymore. But occasionally when she did say something, she would only use past participles in Dutch. So she would say congratulated or gone or things like that, but no other words and no full sentence. So in order for the speech therapist to be able to make a treatment plan, they need to know what issues the adult is having or what issues the child is having. And then that brings us to ethical issues. But before we go there, I'd like to say that the very first time an interpreter may come across a speech therapist will be in hospital, because Linda Hand used to laughingly say, we are also called in to check for swallowing issues. And she says, I don't know why that is. You would think it would be an ENT specialist job, but we are called in. Maybe they think that we're dealing with anything between here and there. So that's also swallowing. And so we're often called in when someone's had a stroke in hospital and they want to see to what extent they can still swallow. Because there's also something else called apraxia, where you no longer know how to use maybe your speech organs. So it's not that your speech center in the brain is affected, but you can just no longer use your speech organs, because there's an awful lot of organs very precisely tuned into one another that we automatically use. And of course, let's not forget, we've learned to speak over. I mean, it's taken humans quite a while in their development from small child to slightly bigger child to learn how to make those sounds. So if something goes wrong and we can no longer use the speech organs, then that's another issue as well. So one of the issues that my students found was there were some that were taking the code of ethics extremely literally. And so whenever the speech therapist would say to them, okay, how is the patient saying that? Or for quite a long time, I had New Zealand Sign Language students in the class as well. And so the speech therapist, the pretend speech therapist would say to the student health interpreter, okay, how does this compare to other people using sign language? And they would say, well, I don't know, because every deaf person has their own way of using sign language. So I can't make general statements like that. So those sorts of general questions put to an interpreter by a speech therapist are actually very difficult for the interpreter to answer, would be probably better answered by a family member. And the other thing is that a lot of interpreters, as I said, when they took the code of ethics very, very literally, so if the speech therapist said, how did they say that? The students would turn to me and go, but Ineke, we're not allowed to do that. We just have to accurately interpret. And I would have to say, no, look, the speech therapist cannot assess the issue if you do not provide that information. And then it became quite clear that some students were very good at providing that information, and other students were at a complete loss as to what to say, because they'd never thought about phonology, phonetics. They'd never thought about that. They'd never thought about how the word order, for instance, or what the issues were. They'd never thought to talk about that. And we call that meta-linguistic commentary. So it's commentary that goes beyond interpreting the language. It's about language. Is that something that you've come across as well, Uldis?
Yes, and it raises a number of ethical and practice issues, and I might talk about some of them now, because yes, this thing of students being put in a situation of saying, well, I just translate the message. What else am I meant to say? And some people, some interpreters are concerned that they're stepping outside their role. Now, the issue here is that you're not stepping outside your role, because what's most important is the purpose of the interview, the purpose of the actual intervention by the speech therapist. The speech therapist is looking for evidence of how the person speaks. And in most cases, it is possible for interpreters to give a description of that. Now, most of the time, in most interpreting situations, interpreters will interpret the message, but they won't necessarily pay a lot of attention to the way a person talks. For example, if you're in a social security interview, and the applicant is actually stuttering, well, as an interpreter, you basically ignore the stuttering. What you're interested in is how the messages are coming across, and there may be difficulties in that, but basically you work through that, but you're not there as a commentator on stuttering. However, for a speech pathologist, if this is a speech therapy situation, the speech therapist is very concerned with exactly where is the person stuttering. Are there certain phonemes, certain sounds, certain words that are barriers? What happens? And this is a kind of a description that any interpreter who understands that language will be able to provide. So there's a lot of possibilities here for interpreters to give that information if they know the purpose of the session. And how you get to know the purpose of the session, of course, and this is very important in speech pathology, but also in areas like mental health and so on, is to know what is the purpose of the interview. What are you doing? Is it assessment? Is it therapy? What are the instruments that you're using? That is the questionnaires or whatever, the realia, whether it's dolls or toy motor cars, whatever it is. You need to know what the speech pathologist is looking for. And often they're looking for features of speech that you can identify as an interpreter, but in other circumstances may not be important, like the stuttering example. But I'll give you an example of how important it is to understand the purpose. In one incident, this is from an academic paper that was actually looking at interpreter performance with speech pathology. It was a Greek patient, and they were talking about clothing, and all of a sudden, in answer to a question, well, what have you got on under your pants? the patient replied what was interpreted as, I've got a boat. And this sounded quite wrong. It sounded quite odd, and it makes the therapist think, well, there's some, thought disorder here. But it turns out that in Greek, the word for boat is varka, but the word for underwear is vraka. So varka for boat, vraka for underwear. What the person was doing was simply mixing up the syllables, and this is typical of certain speech disorders, that you miss up the syllables or you give a wrong word and so on. Now, the interpreter needs to understand that what they're looking for is phonological issues here, exactly what the person is saying and how they're saying it. And if they can convey that, the speech therapist immediately sees, okay, they're transposing syllables. It's not thought disorder. It's actually simply mispronouncing words, and that has got particular causes, and it's also got particular therapies. So the briefing and knowing what you're looking for is absolutely essential. Now, it's very important in the briefing to look at any of the instruments, the questionnaires and so on that are used, because some based upon English grammar, for example, things like tense or modal verbs, that's must, may, things like that, are different in different languages. And of course, word order can be completely different in different languages. So if the instruments are based upon English grammar, the interpreter can speak with a speech pathologist and point that out. There can also be cultural issues. For example, favorite question not only of speech therapists but of psychologists and so on is to get patients to recount the days of the week. And the days of the week in English are Monday and Tuesday and Wednesday and so on, and each day has got a particular name. But in some languages, it's not like that. In some languages, it's first day, second day, third day, fourth day, and so on. And there's quite a difference about simply being able to say first, second, third, fourth, and give the actual names of the days. So these are language-specific issues that the interpreter will be across, but a speech therapist may have no idea, because they deal with a great many languages, and each of them have their particular morphology, their particular phonology, and so on. Now, clearly, in most situations, interpreters are looking to transfer meaning or transfer sense. In some cases, they have to transfer nonsense or things that don't make sense. Okay, but what you're doing is not so much interpreting the message, but translating the data. What is the actual data? How can you identify all the bits of the speech that are being used, and all of that data is useful to the speech therapist, even though you as the interpreter mightn't actually see why it's important. But as long as you can translate the data, it will give the speech therapist a basis for diagnosis or for treatment. Now, speech therapists also, or that language deficiencies can be overcome through careful therapy. There's a lot of therapies that are used. Many of them are concerned with extending people's vocabulary, so naming exercises. For example, you may have a realia, a model of a car. The speech therapist will then ask a series of questions about the car looking for the range of understandings that the patient has with a car. For example, what is a car? How would you categorize a car? And there you're looking for a categorization. Well, it's a vehicle, it's a form of transport, and so on. What are the features of a car? Well, they're automatic or manual, or they're blue, or they're silver, or they're fast, or the red ones go faster, or whatever. What's the purpose? Well, the purpose could be to go on trips or to go to work or whatever. So the speech therapist will give repeated questions like that to improve the person's vocabulary, to get them talking more fluently. And this is a way of therapy. This is a treatment of aphasia. So it's very important to understand that you're not going outside your role as an interpreter to give this data, give this information about how the people are speaking, as well as the actual message of what they've said. It's important, it's absolutely critical to get a briefing, and it's also good to get a debrief afterwards, because things might come up afterwards that you remember. There may be still puzzles in the data. You can work on them together. You are not acting, if you're an interpreter, you're not acting as a speech therapist. You're acting as an interpreter who's informing about language. And every interpreter is basically capable of that if you follow the purpose of the interview. So ethically, yes, it looks very different environment to which you normally work in. It is looking for some different things than, say, a normal, I don't know, legal or medical or welfare assignment. But understanding the purpose means that you can be an effective interpreter in this role. And Ineke, you might like to sum up what we've learned so far.
Then before I sum up, I just want to ask you a question. So let's say we're using the Boston naming test. Boston, of course, being a big city in the United States.
Yes.
I did some research on that, never been published, but with older Dutch adults, when I say older, 65 plus in the Netherlands, and door knockers don't have them over there. So people are like, I don't know, what is that? Oh, it looks like it's on a door, but I don't know what it's for, because everybody has doorbells. So let's say, and was the same, I think the other one was a trellis. A lot of people live in apartments, and a lot of people didn't know what the word was for trellis. That struck me. So let's say if the interpreter comes across that and thinks to himself or herself, wow, that's not really used in our culture, when should they point that out to the speech language therapist?
Yeah, I think you point out things as soon as you realize them. Now, these interviews will be slow. They don't go at a huge pace. The speech therapists will probably be taking notes. So they, at any stage when you feel, wait a minute, there's something here, certainly sort of say it. I mean that vraka and varka example, for example, you should be able to understand that something has gone wrong and raise it immediately. However, the use of the debriefing is also that you mightn't pick up things at the moment, or things mightn't necessarily occur to you. Some of these language issues can be very subtle and very hard to immediately understand. So in a debrief, it's possible to raise these issues, certainly. And certainly a debrief is there if the interpreter thinks, look, something was odd there, but I can't put my finger on it. Well, that's a cue to sort of get together with the speech therapist and go over the data. So it's look, it can fairly typical, I suppose, of other interpreting situations as well. You try and get clarification as soon as you realize that you don't understand something, but sometimes that understanding goes longer. Sometimes you, for example, in an interview, say on Social Security, you're talking about members of the family, but you realize later in the interview, you misunderstood which particular relative they were talking about. Well, you can raise it again with a service provider later, or clarify with the applicant which it is. So it can be at any stage, but don't forget the debriefing stage, because at that stage you may be able to actually rediscover things that slipped by the first time.
Thank you so much. That was incredibly elucidating. So, to sum up then, the briefing is extremely important. It's very important that the speech therapist and the interpreter discuss the purpose of the assignment. Is it to find out what type of language delay, what type of speech or understanding problems there are? What are the tools that are going to be used? For instance, naming tests or realia. Is the speech therapist going to check a child's understanding of 2-element instructions, 3-element instructions, and how is that going to happen? Very important also to have a debriefing in case there are any things that the interpreter wants to bring up that they haven't brought up during the interview, although, as you said, during the interview or as soon as possible is probably the best time for interpreters to bring up any of those sorts of thoughts that might occur to them.
Good, thank you, Ineke. All Graduates does supply interpreters to speech therapy situations, and we hope this podcast will be of help to you in your practice. Thank you very much.
Thank you, Uldis, and thank you, all graduates, for giving us this opportunity to discuss such an important issue. Thank you.
Conversations Podcast.